Hello, students, and welcome to the first official lecture of the semester. Glad to have you with us, and I hope you're doing well. In this first week of class, we're going to be talking a lot about the value of history for understanding public health, not just in the past, but also in the present. Is history a useful tool for public health? What exactly can public health professionals learn from historians? Can our understanding of modern-day problems surrounding infectious disease control, the management and distribution of healthcare resources, or efforts at health education be enhanced by looking back in time? And if so, how exactly can history be brought to bear on contemporary public health issues? How might we extract lessons or solutions from the past in a way that makes things better in the here and now? What precisely is the contemporary relevance of history for public health? And what might we learn from studying this? The current coronavirus pandemic has brought renewed attention to all of these questions. Since the beginning of the pandemic, COVID-19 has brought sickness, death, misery, and disruption to every single part of the globe. At the time of this recording, official estimates put the overall number of COVID cases at around 200 million worldwide. Some 4.2 million people worldwide have died from COVID, officially. In addition to illness and death, this novel virus has strained economic systems, reshaped political power, disrupted cultural norms, and torn at the very fabric of human societies. Over the last 18 months, governments have responded to the pandemic with lockdowns, quarantine policies, mask mandates, and most recently, of course, vaccines. But the virus remains with us. Indeed, with the recent spread of the disease's Delta variant, many countries are experiencing a third wave of infections. Here in Kazakhstan, for example, the last 2 months have been particularly difficult, as both the incidence and overall prevalence of COVID have risen to levels far above those seen in 2020. Death rates have also escalated sharply, leading many to ask, will this ever end? Is the current state of affairs the beginning of a new normal? Or can we do something to flatten the curve and return to the kinds of lives that we had prior to December 2019? And if there is something we can do, what exactly do we need to do to put this pandemic behind us? The uncertainties, unknowns, and unpredictabilities of the current moment are what have inspired engagement with the history of public health, and specifically the history of epidemics and epidemic responses. This is not surprising. COVID-19 is, after all, a brand new disease. It's something unprecedented, and the pandemic it sparked is unlike anything any of us have seen at any point in our lifetimes. The moment is ripe for historical reflection and for retrospective thinking. And among those attempting to make sense of COVID-19 by turning to the past, media organizations have been particularly active. Hoping to use history to extract lessons for the present, newspapers, TV and radio broadcasters, and journalists of all kinds have scoured the past for answers to some of our most basic questions about COVID-19. Questions like, how long will it last? How many will die? How can we hasten its end? As an example of this trend, consider an editorial published in the New York Times in February 2020. Its author, a science writer, encouraged governments to go medieval in their responses to COVID-19, arguing that the kinds of harsh measures political authorities implemented to deal with the outbreak of bubonic plague in 14th century Europe, things like quarantines, the closing of borders, and the forced confinement of citizens within cities with high disease rates, not only worked in the context of the Black Death, but, as the author put it, might actually still serve a purpose in the context of COVID-19. The piece's author acknowledges that the authoritarian approaches to public health seen in medieval Europe were certainly quite, as he puts it, brutal. But nevertheless, he believes that in the case of COVID-19, this iron fist might be more effective than the latex glove, by which he means vaccines, antibiotics, thermal cameras, hospital ventilators, and all of the other tools characteristic of modern public health. While many media outlets have drawn comparisons between COVID-19 and the Black Death, the amount of commentary on this pales in comparison to that linking COVID-19 to another, much more recent pandemic, the 1918-1919 influenza pandemic. The 1918 flu was an extraordinarily deadly event. Fueled by the global military conflagration that was World War I, the disease killed an estimated 50 million people all across the world. Examining this pandemic, the Washington Post called it, quote, the only thing comparable in human history to COVID-19. Like the Washington Post, media organizations all across the world have considered the 1918-1919 flu an historical analog to the novel coronavirus, as can be seen in articles bearing such titles as Coronavirus versus Spanish flu? Which is worse? Or how does coronavirus compare to Spanish flu? Answers to these questions vary. Some news outlets contend that, quote, the coronavirus may be deadlier than the Spanish flu, while others maintain, as one article title puts it, quote, COVID-19 will not be as bad as other epidemics we have faced. Regardless, the common sentiment, as an Australian doctor interviewed for ABC News put it, is that, quote, we probably haven't seen a virus like this since 1918. Moreover, most historians and journalists believe that the 1918-1919 flu offers instructions for the present. This is evident in headlines with titles like, quote, the single most important lesson from the 1918 influenza, and, quote, what the 1918 flu pandemic can teach us about COVID-19, and, to give a third example, treatment pioneered in 1918 could save COVID-19 patients. If you were to read these articles, you would see, interestingly, that according to the media, many of the lessons of the 1918-1919 flu pandemic have, thankfully, already been learned. In 1918, a New York Times op-ed explains, quote, the world was a very different place. Public health was only just getting started. Indeed, it was because of the 1918 flu that governments began enacting the kinds of infectious disease management strategies currently being practiced in the era of COVID-19. Given this, media outlets argue, a repeat of the massive death toll seen a century ago is unlikely. Reports like that you see on the screen here portray public health history in a very progressive way, as a triumphal march from ignorance to knowledge, from superstition to reason and science. Optimistic and reassuring, these pieces create distance between then and now in a way that is designed to allay fears of a COVID-19 apocalypse. However, not everyone emphasizes these discontinuities between past and present. A significant portion of the media's historical coverage of COVID-19 consists of stories that emphasize similarities between then and now. Here, what we see is not progress over time, but a stunning lack of progress. These accounts present the current pandemic as part of an ongoing story that stretches back centuries and that is characterized by a number of consistent themes, among them racism, xenophobia, and scapegoating. Paying attention not just to biological pathogens, but also to the cultural prejudices that often accompany their spread, these stories draw attention to how, as one Washington Post story puts it, quote, outbreaks often have been attributed to marginalized groups in society. Within the United States, for example, much has been made of how former President Trump's tweets about the, quote, China virus are simply the latest chapter in a long history of anti-Asian racism in American public health. Throughout the 1800s, one reporter notes, white Americans universally believed that Chinese immigrants posed a threat to public health and regularly slandered them as uncivilized, unclean, and filthy. During disease outbreaks, these beliefs often inspired violent, murderous attacks. For example, when an outbreak of bubonic plague struck San Francisco in 1900, local authorities quickly blamed Chinese residents, quarantining their communities even while allowing white Americans living nearby to freely go about their business. As a Washington Post op-ed explains, medical experts contended that the plague existed only among, quote, rice eaters, not, quote, meat eaters. In addition to infringing upon their rights, officials routinely ignored Chinese Americans' health needs. As a result, over 100 died. The historical lessons offered in pieces like these are quite different from those that attempt to inspire confidence in modern public health. Instead of trying to convince us how far we've come, these stories suggest that we've hardly made any progress at all. Media accounts focusing on the racialization of disease, the stigmatization and scapegoating of minorities, and the structural aspects of epidemic management indicate that time and time again, governments have misunderstood where and what the real disease risks were. Guided by prejudice, their public health measures have been misguided and counterproductive, all of which has made it harder to get a handle on infectious maladies. Thus, instead of being imbued with an air of triumph, these kinds of pieces are quite pessimistic and suggest that our ability to successfully tackle epidemic disease hasn't improved at all over the ages. And it won't, they argue, until we stop learning to perpetuate racist, stigmatizing, stereotyping outbreak narratives. So, where does this leave us? Returning to our original question, what value does history have for public health? First and foremost, history reminds us that epidemics are much more than biological phenomena. They are not simply a function of germs or viruses. They are also a function of political power, of cultural attitudes, of social arrangements, and of economic circumstances. As such, when studying public health, we need to locate this within its broader social, political, cultural, and geographical contexts. When we do this, we'll realize, as the historian Nayan Shah has so eloquently put it, that, quote, public health reform is far more than the instruments to suppress epidemic illness and enhance human vitality. It promotes a strategy of governance and citizenship with its own ethical and knowledge formations. What this means, practically speaking, is that when we talk about public health, we need to talk about it not only in terms of the success or failure of specific policies and disease control measures. We need to also talk about how public health campaigns impact broader developments in politics, society, and culture. Since public health has historically been tied to matters of governance, political authority, citizenship, and state formation, we need to look at how public health has influenced these things. We might ask questions like the following. Clearly, then, history is a valuable tool for understanding and improving public health. But we need to realize that history does not speak with one voice. It is not one thing, but several. There are histories and pasts, and as such, there's no straightforward, singular, uncomplicated lesson to be learned from any particular epidemic. That's where we'll leave it for now. Thanks for listening to and watching this lecture. Once you've had some time to digest all of this, please head over to our discussion board and share your thoughts. Do you think that history is a useful tool for public health? If so, how? If not, why not? I'm really interested to hear your thoughts on this and to also know what you make of the views of other historians who have written on this topic. So, let's get the discussion going. Until next time, be safe and be well, everyone.